My name is Bakary Suso, and I'm a fifth-year architecture student at the University of Kansas. I am the co-founder of Kinitiative. What Kinitiative is a nonprofit that started last year that tends to study people, their patterns and practices in order to design a better sense of place. Our main goal as an organization is to educate, empower, and enlighten people in terms of not just architecture, but also social entrepreneurship. We are going beyond the architecture to create an impact. Our main benefactor of Kinitiative is the Gambia, West Africa, where I was born and raised. It is one of the smallest countries in Africa. It has 1.8 million people and a place I call home and I love dearly. As an aspiring architect, I've always wanted to see how I can give back to my country. And one of the ways and means that Kinitiative is trying to create an impact is to enhance what you call trekking stations. Gambia has 6 main hospitals, 38 health centers, and 280 what you call the trekking stations. And like I said, these trekking stations can serve a community of 10 villages or up to 50 villages. And you can imagine somebody who came to visit the nurse sitting under 100-degree weather and the hot sun just to be able to get basic health care provided to them.
A trekking station has a component of a public health officer, a registered nurse, and a midwife. What we do is we provide immunizations services to children, maternal and child health care. We go to this particular location on a weekly basis, and then the people surrounding the environment, the villages, will come all together and form a line and get those services from us. The government has built, most of the cases, a roof, small roof, enough to contain a certain number of people, but then most of us will be outside the roof under a mango tree providing services to those people. These are some of the problems that we and my people are facing.
The trekking stations, I have seen some when I went to Gambia in 2013 for my sister's funeral. I went to the so-called hospital that she gave birth in, and it was a trekking station. It was just devastating. For me, it's very emotional to me because I didn't believe that a human being should lay in a bed like that. Actually, when I went there was donkeys and animals, like domestic animals, just roaming around with feces all over the place. But that's the reality. That's why I felt more passionate to give back and also to encourage other U.S. citizens to join me as a force and help those underdeveloped people. Those women need help. Those areas need help. And for me, it's worth every dime that I have. And that's why I am part of this organization. It means a lot to me. If I can save one life, I've already lost my sister, and I don't want to see another woman die.
Our goal as Kinitiative is to go in and have these communities involved in the design and the building process of these trekking stations that we're trying to build. So the idea is that when we leave, these people know exactly what to do if something breaks down. In terms of the community participation, I think it is necessary in terms of us transferring knowledge in such a way that it will help enhance the lives of people that we're impacting.
Well, I think one of the things that Kinitiative does is to collect existing philanthropic as well as technical expertise together. It networks people in ways that is impossible without that kind of non-governmental organization and not-for-profit
I visited this trekking station and asked these people what are some of the amenities they feel like these new trekking stations should have. And some of these amenities included a basic wash hand basin, a sink. And some of the things that we can improve on is having a birthing station in these trekking stations that could be actually used for like a first responder type thing, where these women can give birth mildly comfortably, and then they could be transferred to the main hospital. Because sometimes these villagers, these communities that go to these trekking stations, this is their only access to healthcare.
One of the recognitions that has come about in the past 5 or 6 years is how much effect environments have on the health of communities. Not only personal health, but community health. And especially in some areas of the developing world like the Gambia, it's really critical that architects make an impact in terms of improving environments that also affect directly health and wellness of the communities.
Construction is a cultural thing that has developed over sort of centuries in a particular place based on the materials that are there, based on the traditions of building, based on how fathers taught sons and grandfathers taught fathers and great-grandfathers taught grandfathers and so forth. It's not easy to introduce construction methods to a new place because it's costly to build buildings, it's risky to build buildings, and if somebody already thinks they know how to build them one way, they have no incentive to try to build them another way.
In Gambia, there's our building culture mainly is using concrete cement to build. And that in itself is not good for the environment or the occupants of the building. And it's very expensive. So you can imagine building a whole building out of cement, how expensive it could be. So right now what we're doing is to empower and educate the people on not just, how to build, but also the materials that are readily available in there for them to use. Because we're creating a standard of building where if they see this trekking station get built using compressed earth blocks, they can use the same system to build their homes. Through these trekking stations, we're cutting construction costs down by almost 50 to 70% using this type of building technology.
The thing about stabilized earth construction is that it's everywhere. The entire earth is made of earth. So it's dirt cheap, as they say. And so if you can find a way to turn earth into a stable construction material, then it's probably accessible for sort of most people on the planet.
We want first Gambia to be the test site. Once we are successful in Gambia, we want to use that same strategy and travel through the world, provide the same infrastructure to areas that need this service. This is going to save women's lives. This is going to save many children. The trekking stations, when they get improved, it's going to be a structure that people will feel comfortable going to because they know that they can, even if they don't want to be there for a health reason, they can just go and sit in a clean environment. Just that feeling of, I can go to this room and just sit there and just relax, means a lot. It means a lot. So I'm pleading to people to help us make this a success. I want us to see the end result feels good. It feels good because you know that you are providing, not only providing, but you're saving people's lives. The end goal is to save people's lives.
One thing I notice about Gambians is that no matter how bad things get, we're always smiling. I mean, I've been to the poorest parts of this world in the Gambia, and you see these women walking for 9 miles at a time. But I started talking to them, and one of the things I noticed is that their attitude and their smile, I mean, they're always smiling about, everything. Even though life has been very hard for them, they're always, no matter what happens, have a positive attitude about everything. And I think that is a driving force for me. I think that is what keeps me going, and that is why we're starting in the Gambia, because I know that these people need our help the most. And with the positive attitude that they have, I want to be able to help enhance that more. And also, Gambia is called the Smiling Coast. So I think that's beautiful in itself, and just being able to help.
Yeah,